Bismillahirrahmanirrahim. Assalamu alaikum. Dear friends, today we are going to discuss about the causes of abnormal uterine bleeding and how to take history of any patient who presents with bleeding irregularities. Causes of abnormal uterine bleeding, they are broadly classified by the FIGO into two main groups that are defined by the mnemonic palm coin. PALM, it defines the causes that are structural causes that can be identified by an ultrasound imaging or by the histopathology, and they include polyp, adenomyosis, leiomyoma, malignancy, plus minus hyperplasia. Coin group includes non-structural causes that cannot be diagnosed with ultrasound or any imaging modality or by the histopathology. They include coagulopathy, ovulatory dysfunction, endometrial disorders, iatrogenic, and not otherwise classified. This is the broad classification of the abnormal uterine bleeding. So let us discuss about the history taking. How to take a history of any patient who presents with the bleeding irregularities. Whenever a patient presents with the bleeding problems, you can take history by just memorizing the mnemonic palm coin, or you can take history by another formula which will be discussed in a few minutes. When a patient presents, you always need to ask about the presenting symptoms, like either there is heavy menstrual bleeding, prolonged cycle, intermenstrual bleeding, postcoital bleeding. What is the pattern of the bleeding problem? And then you need to determine the impact of the well-being of patient. Now you can take a history by just memorizing the formula A, B, C, D, E, F, G, H, I. Now let us discuss what A stands for. A stands for anemia. So whenever a patient having bleeding problems, she must be anemic. Always ask about the symptoms of anemia. Either she has shortness of breath, fatigue, fainting episodes, lethargy, or there is any history of blood transfusion in the past. Determine the bleeding pattern. B for bleeding, determine the bleeding pattern. Either there is intermenstrual bleeding, heavy menstrual bleeding, postcoital bleeding, or cycle irregularity. When you are taking history about the heavy menstrual bleeding, you must need to ask about amount of the bleeding, what is how many pads she use, is there any staining of undergarments or fainting episode. Then when you are taking about the postcoital bleeding, you must ask about any vaginal discharge, history of vaginal discharge, and pain, pelvic pain. C stands for coagulopathy. When a patient presents with the bleeding problem due to coagulopathy, there must be history of bruising, nasal bleed, parectal bleed, or history of heavy menstrual bleeding since menarche, or there will be family history of the bleeding disorders. D stands for drugs. Always ask about any drugs like warfarin and clexane that may cause any bleeding problems. E stands for endocrine problems, like the problems are related to PCOS, hypo and hyperthyroidism, and related to prolactin abnormalities. If a patient has PCOS, she must be having the delayed menstrual cycle. There must be history of hirsutism or weight gain. Hypo and hyperthyroidism, you need to ask about related symptoms, and prolactin, like is there any headache or galacturia present or not. Then G and F relates to the fibroid. If there is fibroid causes problems like heavy menstrual bleeding. If there is submucosal fibroid, it can cause any pressure symptoms like urinary symptoms if the fibroid is interior, or bowel symptoms if the fibroid is posterior locating, or it can also cause any infertility or subfertility problems. So you must need to ask about the history of fibroid or any growth in the lower abdominal region. H stands for hormone therapy, if she is using any contraception or not. And I stands for infections. Infections is the most common cause of the postcoital bleeding in the young age. And this was about history taking in a patient who presents with the bleeding irregularities. And then in our next video we will discuss about examination and management.